My name is Dr. Ephrem Tekle. I'm a Director for Maternal and Child Health in Ethiopia, Federal Ministry of Health. In this Commission for High Quality Health Systems, I am the co-chair of the first group that works on defining quality and describing the burden and also stating the burden of low quality in general. My expectation from the Commission is at the end of, this Commission that a fresh perspective of understanding quality in a very different way. Um, I mean, I don't really expect completely different findings, but at the same time, I expect that the idea of quality will be described in a much more granular way and in a much more practicable and implementable way. Because these days we define quality in a much more hypothetical and very hard to understand conceptual frameworks and schematics. But I'm hoping that at the end of the Global Commission will be able to state in a very layman terms about what quality is, what are the critical things that we need to think, and how quality improvement can be done in a much more understandable and context-specific way. Well, I come from a country whereby, considerable achievement has been achieved over the past few years in bringing universal health coverage towards people and increasing the number of health facilities, number of health professionals, and improving the way supplies are provided, etc., have been continuously improving. And so access to services have considerably improved all over the country. But despite improvements in coverage for several services that we provide in the community and beyond, there has been considerable limitations in improving quality. Even though we have expanded access to services, still quality of service provided in each facility is a clear problem, especially in our primary care setup and in the secondary and tertiary level. So this is my participation in this commission, and perhaps my work at a country level, which we do have a national commission working on quality, is that we'll be able to provide proper insights and the available evidence to decision makers and program implementers to see program delivery beyond just coverage and beyond just statistics data, to look into how services are provided so that morbidity and mortality can be properly addressed, and the resources spent on healthcare can also be utilized to bring better outcomes in general.